this lesson, we're going to look at high-risk behaviors. The reason we want to look at high-risk behaviors is that it's a safety assessment issue. We are going to help to identify any safety concerns we have as a result of high-risk behavior. The first one we want to look at is substance use or substance abuse. So drugs, alcohol, tobacco. Drugs lead to poor decision making, and which could lead to a potential injury. Alcohol and tobacco use both have potential health ramifications like cirrhosis or liver failure or different types of cancers. All of these are a result of high-risk behavior. The other one we want to look at is risky sexual behavior. So what does this mean? Risky sexual behavior is multiple partners or unprotected sex. And what that means is that just leads to a higher occurrence of potentially sexually transmitted infections or unplanned pregnancies. So this is a type of high-risk behavior. Diet and exercise is on this list, and everybody would assume that that diet and exercise is not a high-risk behavior. In fact, it is. And the reason it is because poor nutrition and low exercise or exercise, sorry guys, low frequency of exercise or low activity levels contribute to all sorts of long-term illnesses. So you can have things like hypertension or type 2 diabetes or other types of illnesses. And these are all a result of generally poor diet and low activity levels. There are other types of risky behaviors. So unsafe use and storage of firearms are one, or unsafe use of vehicles like texting and driving, or combinations. So driving while intoxicated is a risk factor or a high risk behavior with alcohol use and poor use of a vehicle. And the idea here is we want to identify different types of behavior that could cause illness or injury or disease. But why do these happen? And so that's what we're going to take a look at next. In order to get a better understanding of high-risk behavior, we have to understand why these things happen. So first off, we're going to look at a little evidence-based practice for you, which is a cornerstone of nursing. So you always want to refer to your evidence-based practice and your evidence. So there's a ton of research in this area, and general education, being low education levels or generally illiterate, they have a relationship with high-risk behaviors. And so that means is that if a patient is poorly educated, they're more likely to engage in high-risk behaviors like smoking, drinking, drug use, and other risky behavior. Now, this doesn't mean that people who are highly educated aren't clear of any high-risk behavior. It just means that sometimes they just don't understand their behavior or their implications of behavior. So some people think that they exercise enough when in fact they don't, or that they're eating a good diet or they're on a good nutrition plan and they're just not. Oh, well, I'm eating chicken and I'm eating this. Well, what kind of chicken are you eating? Well, they're chicken nuggets. Well, that's not good for you because they are saturated in oil and they're fried and they have a higher calorie content. So sometimes they just have a poor understanding of a type of particular high-risk behavior. And then there's this other part, disregard or apathy. Some people just don't give a damn. They just don't care that they're engaging in high-risk behavior. And that's a group, and I promise you, they're going to frustrate you to no end. But we're going to navigate that a little bit later. But you just have to understand that there are people that just don't care. And that's okay. But now we want to know on how we work to fix this issue. So let's look at some things that you can do as the nurse. First, you have to identify the cause. So what high-risk behavior are they engaged in? And what do you think that potential cause is? Do you think it's based on like a general knowledge or a lack of general knowledge? And if that's the case, then explain it to them. Do they not understand that one particular like we talked about? Do they not understand the implications of a high risk? Do they not understand that one particular thing is actually a high risk behavior? If that's the case, then explain it to them, educate them. You always want to educate them. Make sure that they have a good understanding. Do you understand? Hey, I know that you're drinking, you're having a, 2 to 3 glasses of whiskey a day. Do you think that that's okay? No. Well, understand it. Oh yeah, I understand that I'm drinking it. And if that's the case, then do they just not care? If that's the case, like I said, some people just don't give a damn, and that's okay. And what your responsibility here is, you need to make sure that you educate them until you're blue in the face. Hey, I educated. I told them, hey, don't do it. This is why. I provided evidence. But as long as you, at the end of the day, have shown that you're a patient, that you gave a damn about them, and that you educated them, and that you did your absolute best in providing them the most recent relevant information and education in that particular high risk area, and as long as you've done that, then you can sleep okay at night. Because I've done that. The job isn't always pretty, and I've slept okay at night because I did my part, because I showed up and I showed my patients and I told them what they needed to know. And if they didn't care, then they didn't care. But as long as you do that, then you'll be all right. Because we wanted to focus on finding the risks for your patient, the big nursing concept for today is safety. And then we also focused on health promotion, so promoting your patient's health and wellness through education. So let's recap. When we talk about high risk behaviors, what are they? So drug, alcohol use, poor nutrition, other risky behavior. These, you want to identify that cause. Then you figure out what causes them. Do they not care, or are they just not educated? And so this is where you step in. What can you do? Educate, educate, educate. If you do these things, even if your patient doesn't give a damn, at the end of the day, know that you can sleep okay at night. That's it for our lesson on high risk behavior. Make sure that you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.